Welcome, everyone, and thank you for joining us. I'm Julie Cullen, Managing Editor of American Nurse Today, and I'll be serving as your moderator. Our topic for today's webinar is Collective Competence in Workforce Development, a Strategic Quality Initiative. Our presenters are Suzanne Taylor and Sandy Hall, both of whom are actively employed by Children's Hospital Los Angeles. Sandy is a manager of nursing excellence at Children's Hospital Los Angeles. She oversees CHLA's magnet designation, as well as working to drive nursing outcomes and evidence-based practice within the organization. Prior to her current role, she managed Versant's RN Residency and Transition RN Fellowship programs at CHLA. She's certified in both nursing professional development and as a nurse executive. She holds a master's degree in nursing education and an MBA in healthcare management. She'll be completing her Doctor of Nursing Practice degree in 2019. Suzanne is currently the Director of Clinical Education and Professional Development at Children's Hospital Los Angeles, where she oversees education for orientation and ongoing staff professional development, including Versant's RN Residency and Pediatrics program, the Magna program, and the Simulation Center. She's been employed at CHLA for 24 years, and her nursing background has been in the neonatal intensive care unit, where she was a member of the ECMO team. She holds a master's degree in nursing with an emphasis in nursing education and a doctor of education with a specialty in adult education. We welcome both presenters today and thank them for their time and valuable information. This educational program is brought to you by Versant. Versant is the only competency-based solution that assesses, remediates, and validates all nurses across the continuum of care. The result, better nurse confidence and satisfaction, reduced turnover, higher reimbursements, and reduced costs due to medical errors. With 2 decades of providing these proven quality of care outcomes, Versant continues to help health systems achieve both their clinical and financial goals. We thank them for their support. To maximize your webinar experience, please note these important housekeeping items before we get started. First, the content of today's on-demand webinar will last approximately 30 minutes. The last 10 minutes includes questions that were asked by the audience and answered by our presenters during the live webinar. You can share the full replay of the webinar with your colleagues by accessing educational webinars under the Resources tab at americannursetoday.com. If you have any questions that were not answered, a contact email will be posted at the end of the webinar. And now I'd like to welcome our first presenter, Sandy Hall.
Thank you so much, and we'd like to say a quick thank you to American Nurse Today for inviting us and to Versant for sponsoring this presentation. We're here today to talk about collective competence in workforce development and how that ties in with our strategic quality goals. So our objectives for today's presentation include defining the role of collective competence in achieving patient safety and our organization's strategic quality goals. As well, we're going to discuss how our nursing workforce strategy can help us to meet the organization's strategic quality goals. And we're also going to discuss the outcomes of the workforce development initiative that we have in place here at Children's Hospital Los Angeles. So first, let's discuss the relationship between collective competence and strategic quality goals. And before we really get into this, I want to take a moment to define collective competence so that we all have sort of a general understanding of what we mean when we discuss that. Dr. Lorelei Lingard has written that collective competence is about more than the people on the team and how they function as members of that team. It's about what happens when individual experts are able to function with a sense of awareness of one another, as well as an awareness of the various structures and resources in the system that either support them to work together or inhibit them from working together. At Children's Hospital Los Angeles, we are leveraging a number of internal and external resources to ensure that we continue to develop and nurture collective competence throughout the organization. This ongoing work helps us to make continuous strides in achieving our strategic quality goals. A number of forces within healthcare have led hospitals and healthcare professionals to place a high value on quality principles, and to create a culture of transparency and care. As this evolution continues, we must find ways to not only keep up, but to stay ahead of emerging trends in quality and safety. At Children's Hospital Los Angeles, our quality and safety strategic goals center around the concepts of zero harm, performance measurement, quality recognition, performance improvement, and continuous readiness. Each member of the CHLA team plays a vital role in contributing to the organization's achievement of these goals. Within nursing and throughout our clinical services, we strive to achieve collective competence through a focus on developing individual competence while maintaining a continuous focus on principles of communication and interprofessional collaboration. The major areas of focus for competence within our span of control include new graduate nurses, experienced nurses transitioning between areas of specialty, preceptors, and newly hired clinical staff members from a variety of disciplines.
Thank you, Sandy. Let's now talk about some of the strategies that we're using to ensure that we're moving our nursing workforce toward collective competence. As the founding hospital of Versant, we at CHLA are proud of our collaboration with Versant to build our nursing workforce and to ensure a high level of quality in our transition to practice programs. Using their competency-based system, we can ensure that all of our nurses are validated on competencies that are appropriate for their area of specialty. Competency profiles are created here at CHLA based on the scope and standards for each specialty area, and profiles are consistent for all nurses in each individual department. For example, any nurse working in the pediatric intensive care unit, regardless of their level of experience, which could range anywhere from being a new graduate nurse to many, many years of experience, must have the same competencies because they perform the same job. While they may function at varying levels of competence or expertise, they are still responsible for the same patient population, and therefore their competencies must be aligned in order to reflect that. Our new graduate RN residency program was founded at CHLA in 1999. The program is offered twice per year with an average cohort size of 50. Since its inception, we have held 35 cohorts, and a total of 1,460 nurses have completed the program. We have worked to continuously develop and improve the residency over time, and we measure outcomes from every possible perspective to ensure that the program is consistently meeting organizational goals. The program is comprised of core pediatric and specialty-specific curriculum, precepted clinical time, and supportive components such as professional mentorship. The RN residency is a one-year program with a 22-week immersion and places a heavy focus on interprofessional collaboration. Residents are given the opportunity to interact with professionals from most clinical disciplines within the organization, including physicians, social workers, registered dietitians, respiratory therapists, physical and occupational therapists, child life specialists, chaplains, language interpreters, laboratory scientists, and others. The Versant RN residency in pediatrics was first accredited with distinction through the ANCC's Practice Transition Accreditation Program in January of 2015. We achieved reaccreditation also with distinction in December 2017. Our Transition RN Fellowship was established in 2015. Drawing from our new graduate program, we provide a condensed 6-month program with a 12 to 16-week immersion. While the program components remain similar to those of the new graduate RN residency, the Transition RN Fellowship is geared to support experienced nurses with at least 1 year of experience transitioning to pediatrics from a different area of specialty. This program has provided benefits to fellows in offering them an opportunity they may not otherwise have to transition to pediatrics in a supportive and structured environment. And it also allows nurse managers from throughout the organization to make strategic hiring decisions based on values and fit rather than the previous work experience in an area similar to that of the hiring unit. We also hold two cohorts of this program per year, and since its implementation, a total of 6 cohorts and 113 fellows have completed the program. In the past several years, we have undergone a massive shift in competencies at CHLA. For countless years prior to the inception of the RN residency, we relied on generic paper competencies for all nurses. The only differentiation in specialty may have been med-surg versus ICU. However, our competencies were in a checklist format and not very sensitive to the complexity of the work that our nurses do on a daily basis. When the RN residency was developed in 1999, a team of Versant and CHLA staff defined a set of competencies for new graduate nurses. In 2004, those competencies were transitioned from their paper format into Versant Voyager, an online competency management system. In 2008 and 2009, Versant created Versant Competencies Assessment, Acquisition, and Tracking System, also known as VCAT, to allow hospitals to validate all nursing competencies in Versant Voyager. CHLA piloted this program and began using the system for all new hire nurses. It was initially comprised of a different set of competencies than the new graduate competencies, and the system's functionality did not allow for integration between the two groups. In 2015, Versant reviewed and redesigned their competencies as part of their work in launching a newer competency management system. These new competencies were seamlessly aligned between new graduates and new hires and relied heavily on concepts from CUSIN to place a heavy focus on patient-centered care, teamwork and collaboration, evidence-based practice, quality improvement, safety, and informatics. Over 350 competencies were reviewed and made available to us. Our managers are now able to select appropriate competencies for their departments based on the ANA scope of standards, as well as specialty scope and standards, and the department scope of service. Versant regularly reviews and updates the competencies based on national standards, regulatory agencies, and current evidence. In 2016, NPD specialists at CHLA formed a group called the Competency Oversight Committee that we called COG. This group initially worked with educators and nurse managers to develop supplemental competencies to enhance the extensive competencies offered by Versant. We then began working with leaders and clinicians from non-nursing professions to develop and identify interprofessional competency. We found that a number of foundational nursing competencies applies to other professions, and we are able to use the CUSIN-based competency model to capture the work of our colleagues. This has helped us to support them in building a set of competencies for a number of disciplines. In 2017, members of the Competency Oversight Group worked with other nurse leaders to develop a set of competencies for unlicensed assistive personnel, including nurse aides and medical assistants. Competency development work at CHLA is an ongoing process, and we have a number of opportunities to grow this program in the future. Versant has also begun working to develop role-based competencies that extend beyond the needs of the new graduate or newly hired nurse. Knowing that the work of the preceptor is critical to the success of any nurse learner, Versant conducted a job analysis in collaboration with expert preceptors from around the United States. This job analysis led to the development of 4 preceptor competencies. Following the release of these competencies, a group of nursing professional development specialists at CHLA conducted an overhaul of preceptor training to align our curricular outcomes with the preceptor competencies. This competency-based preceptor curriculum allows us to ensure that all preceptors in the organization receive comprehensive training and support with a focus on those concepts and outcomes which are central to the success of the nurse being precepted. We began using these at CHLA in 2016, and we've been continuously working to ensure that all of our preceptors are evaluated and ultimately validated on these competencies. This work is ongoing as new preceptors are regularly being identified and trained.
Thank you, Suzanne. So now that we've discussed the 4 areas in which we've applied our strategic workforce development initiative, let's discuss outcomes for each component. There's a strong relationship between the work we're doing with competency and workforce development and ANCC recognition as well. Looking at the criteria for both the Practice Transition Accreditation Program and Magnet, we can see how a strong competency model contributes to achievement of accreditation for transition to practice programs, and further, how achieving accreditation for the transition to practice programs contributes to the ultimate achievement of Magnet designation. We measure a number of outcomes for our transition to practice programs. As an example, the Versant Self-Efficacy Scale measures the respondent's ability to confidently perform skills that are foundational to nursing practice. This scale is most effectively considered as a change over time. In the graph on the screen, you can see the change from the beginning of residency immersion to the end of residency immersion for our new graduates. You can see that CHLA's new graduate, represented in blue, progressed from 3.45 on a 5-point scale at the beginning of their immersion to 4.06 by the end of their 22-week orientation. This helps us to know that their competency validation is truly reflective of growth and increased confidence over time. In addition to this scale, Versant and CHLA measure a number of performance and process metrics to ensure that the program is meeting key target benchmarks. We also conduct a number of assessments and evaluations to better understand the needs of new graduate nurses, as well as their perceptions of the program and its efficacy in supporting their career transition. Outcomes and metrics for the Transition Fellowship Program mirror those of the new graduate RN residency. The Versant Self-Efficacy Scale, once again, provides us with insight into the program's effectiveness in building confidence in foundational nursing skills. The Transition Fellows, represented in blue, progressed from a beginning of immersion score of 3.99 out of 5 to an end of immersion score of 4.17. While this change over time is slightly less dramatic than that of the new grads, it makes sense when we consider that Transition Fellows are coming in with experience. It's helpful for us to know that while the increase in confidence is somewhat less significant, the program does still have a positive impact in their confidence to care for our acutely ill patients, and that competency validation is still reflective of that growth. To date, we have more than 2,800 users with active profiles in Versant Voyager, our online competency management system. More than 700 of those users have been assigned to VCAP's competency profile. While we've not yet progressed to truly measuring outcomes like self-efficacy related to our VCAP program, a number of process measures indicate that we are moving in the right direction. A total of 29 departments have developed competency profiles. This includes not only all inpatient nursing areas, but also a number of specialty nursing and ancillary departments. A number of competencies and competency profiles are also currently in development. CHLA's Competency Oversight Group provides ongoing support to all clinical areas, with the ultimate goal of including all clinical services departments into Versant's standardized competency design and validation model. For preceptor role development, we assess both the self-efficacy of our preceptors over time, as well as preceptor perceptions of the support that they receive in their role. As the self-efficacy graph illustrates, the aggregated confidence level of our preceptors in their role has increased from a baseline of 3.67 out of 5 at the beginning of the role development program to 3.71 at the end of immersion, and further to 3.87 after a year in the role of preceptor. While this represents a positive outcome for our preceptor role development program, we are continuing to develop and refine strategies for preceptor development and support to ensure that they are highly confident and competent in their very important role. So, in summary, it's very easy for a hospital's nursing professional development specialist and department to be far removed from the organization's quality department and strategic quality goals. More often than not, these groups may operate in silos where the right hand doesn't know what the left hand is doing. By aligning workforce and professional development with strategic quality goals to achieve a higher level of collective competence, we are able to help the organization to drive all of our professionals forward in achieving our strategic quality goals and providing superior care for our patients. We want to thank Versant for sponsoring this webinar. As we mentioned, the Versant RN Residency was founded at Children's Hospital Los Angeles. It has since become the national model for transition to practice. Versant now addresses the needs of all nurses from new grad to advanced practice RNs and has expanded from pediatric acute care nurse development to all acute, long-term care, and home health nurses. If you wish for more information, please do not hesitate to visit their website and email or call. Thank you all so much for your time, and at this time, we'd be happy to answer any questions.
Thank you to our faculty for a very informative presentation, and thank you to all of our attendees for your time today. We do have a little bit of time for a few questions, so let's get started. The first question is for either presenter. As a small organization, does it still make sense to partner with someone like Versant to implement a new graduate residency?
So I believe that yes, it does. In order to really successfully launch an RN residency program, there are a lot of components that need to be included, from competencies and outcome measurement and supportive components, and looking at sort of the standards that are set out for an RN residency through accrediting bodies. There are definitely some components that have to be included in a program, and I think especially for a small organization that might not have the resources of a larger hospital, partnering with a company like Versant is really helpful in being able to put all of those pieces together and have that support to successfully launch and run an RN residency.
How has this impacted turnover?
So our turnover rates, the most recent turnover rates that I have are for our new graduate RN residents. Looking at the evidence, it looks to me, the most recent numbers I've found are from a 2014 study that show that the national new graduate turnover rate is about 17.5% at 1 year and 33.5% at 2 years. At CHLA, our new graduate RN resident turnover is 4.73% at 1 year and 8.72% at 2 years. And overall, our nurse turnover rate is right around 5%. So we're very happy with where our turnover has landed as an organization.
We are building our own residency program. What tips do you have for us?
Well, I think the main tip would be is that you need to have solid metrics to measure your program. I know I was on the original developmental task force 20 years ago when we started this program here at Children's Hospital Los Angeles. And the rigor that went into the program has been amazing. And of course, now that it's been in existence for 20 years, it's just gotten stronger and stronger. And the one thing with Versant, with the metrics that they have, that we're able to benchmark ourselves with other Versant clients, which is extremely helpful in order to know where you are in the market and what your areas for growth are.
The other thing that I would jump in and say is that you want to make sure you have your ducks in a row in terms of being able to conduct a return on investment. So it's important to know ahead of time sort of what your existing turnover is, what money is currently being put towards orientation, and to keep close track of the work that you are doing and the expenses that are being incurred by creating an RN residency program so that you can really track a return on investment. In addition, I would really suggest setting a really solid set of goals for a program and making sure that those goals are aligned with outcomes that can be measured in order to determine the success of a program.
Did this help you achieve magnet recognition?
It absolutely did. First off, there is a component of Magnet SE9 at this point in the 2019 manual that is directly correlated to our ability to onboard and support a transition to practice for a number of different types of nurses, nurse managers, APRNs, new graduates, transitioning nurses. Having our new grad program and our transition program has really allowed us to speak to that. And in fact, our RN residency program was an exemplar in our last Magnet Magnet designation.
How did you budget for the preceptor workshop? Seems like a lot of resources were needed.
So our group that plans and executes the preceptor workshop is comprised of managers and educators from throughout the organization who are exempt. So there isn't a lot of extra sort of personnel cost that goes into the execution of that workshop. That said, we do have to ensure that we can pay for the people who attend. And because precepting is such a priority for our organization, that's included and accounted for in each unit's budget.
How did you get buy-in from your experienced nurses having to be validated on competencies again?
So we didn't require all of our experienced nurses to be validated on all of their competencies again. We recognize that in the past, because we had these paper competencies, we do have some form of documentation of the level of competence of our nurses. And it was not a good, we identified it as not being a very good use of our resources from a standpoint of sort of financial and resource stewardship in the organization to revalidate every RN on every competency. So we really made a decision as a governing group with our steering committee and our educators within the organization that as we implemented the Versant Voyager system, that moving forward, we would do all competency validation using that system. If new competencies are assigned for a particular work area, then certainly those competencies might be validated for an experienced nurse within the Versant Voyager system. But we really didn't think that it was the best use of our time or resources to go back and retroactively revalidate competencies for everyone.
Well, that's all we have time for today. And just a reminder that you can share this webinar with your colleagues by viewing the on-demand posting on AmericanNurseToday.com. If you have any further questions, please submit them to the email seen on the screen, and you'll be contacted in the near future. Thank you again, and have a great day.